Do you predict behavioral changes going forward in the long run because of COVID-19 at the global level, at the state level? Are we seeing them at the individual level, and will they last?
That's a great question, and that's really what the academic community that studies human behavior around public panic, around these types of reactions and responses to global risks of this sort, that's what we're hoping for. What we want is to learn from infectious diseases that have emerged and persisted in the past. There's so many lessons to take away from SARS, from MERS, and now from COVID-19. What we hoped to see was that some of that would have been applied to COVID-19, so you wouldn't see that global public panic, and that people would respond in a measured way that's aligned to the reality of this risk. And that risk is still significantly low for those outside of Southeast Asia, where we are seeing community spread. But here in the United States, people still need to heed the experts' warnings and to treat it the same way you would prevent and protect yourself from the seasonal flu. Take these precautions while the global system moves to contain and protect the global public. So we're hoping that at an individual level, people don't panic, people engage with credible evidence and behave in a way that is aligned to what the experts are saying. And then in the future, we have all these systems in place, because these viruses are inevitable. They will emerge. This will happen again, and it might be more lethal. So we really need to get it right now.
And there were some measures put in place following previous outbreaks, including SARS, airports, for example, installing hand sanitizers. And we saw some of those last, but some said that's not enough. Do you expect long-term changes, given the fact that we're in 2020, that there's a lot of information out there about this? You've got social media. Do you expect some long-term lasting changes because of COVID-19?
Yes, and we're definitely hoping that that will be the case. We have 10 years since the last major pandemic, and there's a chance that COVID-19 will become a pandemic if we see it continue to cross countries and across the globe as it's taking off and continuing to move through the global populace. So because we have more information, and we have years of information now regarding how we see this virus, these different types of infections spread, that let's actually get a grip on it, get our act together, and put these practices in place and actually maintain them. Because it's true, after a period of time, people forget. And so we really just need to, as a academic community, very accurately communicate to the public what needs to be done on an individual level. Exactly that.
You focus a lot on risks and behaviors associated in those risks. South Korean authorities are talking about a super spreader, one person spreading to many others. Given how we interact now and how big our cities are, is that to be expected more and more?
Super spreaders are an interesting phenomenon. The idea behind that is that if the virus is shedding, they are more contagious than somebody who might be in a different phase of experiencing the infection. And so it really just comes down to timing, and that what unique features that individual has that we are still learning and figuring out. We're going to have a lot more information on this. The World Health Organization is now on the ground in China. And remember, China is a few weeks ahead of the rest of the world with this virus. So there's a lot still to be learned, and a lot that can help the rest of the global community now address some of these issues and concerns that you're raising, because we'll see how the virus spread through where we say that the virus originated, although there's a chance coronavirus has already been out there. There's a chance this didn't actually just start for the first time. It's now being diagnosed as coronavirus. But given these symptoms we've seen across, they're similar to other flu-like symptoms and common colds even, maybe this had broken out in the past somewhere, and it's just reemerged. So we'll have a much better idea of exactly where it came from, how it spreads, thanks to being able to see how it affected China and that population first and foremost, and then other systems, health systems in other countries will be better prepared.
And many Chinese businesses are reopening quickly. Do you think that's wise?
The issue with that is that even though we've gotten a grip on it now in China, once people start interacting again and then get back on public transportation and go back to work, there's a chance it could reemerge. That being said, we need to go back to business as usual. Ultimately, there's the ripple effects of this, the economic costs of this is going to cost way more than the actual fatalities of the disease itself, right? Because we'll look back on it and the numbers will still be most likely far less than even the seasonal flu in the United States. The amount of people infected globally with coronavirus is equivalent to a bad seasonal flu year in the United States. And 100 almost children have already been killed in the United States from the seasonal flu. And this virus, the coronavirus, doesn't seem to be impacting children in the same way. So we'll probably look back and see this not as bad as what we've already anticipated with other infectious diseases, what we already know. But that being said, we need to be careful as people return to business as usual, because then it could emerge again.
All right, Shita Chakraborty, thank you so much for joining us.